You are watching 2+U Nevada, and I'm so excited to have Dr. Angelique Tay, a neurosurgeon at Sierra Neurosurgery Group, joining us again this afternoon. First and foremost, not only are you a brilliant woman, but a mom to 3 kids younger than 3, or 3 and younger. Wow, that's a lot. Thank you for being here this afternoon. Now, Dr. Tay, you just moved here, joining the Northern Nevada region, and you are the only fellowship-trained functional neurosurgeon in the area. That is huge for our community. What drew you to Northern Nevada?
Well, I've been all over the country for medical training, and I really just missed the 4 seasons. And I wanted somewhere I could raise my kids. We can go outdoors. We can enjoy, the world around us. And also because the patients here needed a functional neurosurgeon.
Yes, because where would they have to go before?
They would have to go to Stanford and California. They would have to go to Utah, Arizona, and wait at least like 6 months before they were seen.
6 months before they could be seen by a functional neurosurgeon. So you actually treat spinal pain, movement disorders, Parkinson's, spinal CSF leaks, epilepsy, and chronic pain syndromes. But let's talk specifically about Parkinson's, because you have a treatment called deep brain stimulation, or DBS. Can you explain what that is?
Yeah. So for patients with Parkinson's, we put 2 electrodes in, and we kind of connect it to a pacemaker. They kind of call it a pacemaker for the brain. And it is on all the time to try to change the electricity in your brain so that you're able to do functions that you weren't able to do before. For instance, holding a cup, writing, walking. All those things improve with this deep brain stimulation.
Stuff that we just take, for granted.
Yeah.
It really alters a person's life if they're unable to even hold a glass of water, for example.
Right.
And so who is a candidate for DBS?
So patients who respond to levodopa, the medications, patients who've had Parkinson's for over 4 years, and also patients who kind of go through a testing for neuropsych to make sure that there's no cognitive issues.
What happens during this type of surgery, DBS, and then what is recovery like?
I know it sounds a little scary, but you put 2 little holes in the skull and you put the electrodes through based off a frame that is printed specifically for each patient. So it's a 2-stage thing. The first stage is you put gold markers in, and we have frames custom made for each patient. They come back a week later and we put those electrodes in, and we test them in surgery to make sure that they have a good response to the stimulation.
So is your patient awake during the surgery?
Not the first one, but the second one, yes.
Because you're testing their motor skills to see where the electrodes actually go and how to best get them to work.
Right, and to see if there's any side effects of the stimulation.
Okay. What are the benefits and risks?
Well, the benefits, I think, are pretty obvious. A lot of patients say that their life has been returned to them.
100%.
And the risk of it, we've gotten better throughout the years. It used to be like a 5% risk of hemorrhage, and now it's like less than 2%. And also a risk of infection, also less than 2% now. So,
okay, and then what happens long-term after somebody has this DBS surgery?
Well, the surgery itself is not curative of Parkinson's. It treats symptoms, but a patient would notice that if they ever turn off their deep brain stimulation, the symptoms will be a lot worse. So the good thing about deep brain stimulation is that the stimulation can increase as their symptoms increase.
Okay, so do you then increase those, or does the patient have control of that increase?
We have control of it. The battery, we just put something on top of the battery and reprogram it. We don't have to do more surgery for that part.
Oh, okay, yeah. Wonderful. And then we have 2 minutes left. With that, I know by the time you are seeing these Parkinson's patients, they've had it, you said, at minimum 4 years. Mm-hmm. But early Parkinson's, what are some of the symptoms that people need to just kind of pay attention to even get that initial diagnosis?
Sometimes it's not so obvious. It's sometimes just a twitch in the hand, a tremor that won't go away. And sometimes it's just slowness in movement, or what we call like mass facies, where their face, we normally just move your face a lot, just naturally. But for some reason, they just stop moving their face, they become emotionless. That's one of the symptoms too, or they just can't get up from a chair.
And does it take somebody else noticing the symptoms usually, or does the person notice the symptoms in themselves?
Oftentimes, if it's not the tremor, it's other people noticing first.
Because of that face,
yes.
Like the lack of emotion.
Or the difficulty getting up, or the slowness in movement, which sometimes your partner notices before you ever notice.
Well, you are accepting patients now, and with the wait for other neurosurgeons in other states at like 6 months, how soon can people get in to see you?
About like 1 to 2 weeks.
That's just unheard of. Yeah. Thank you again for being here, Dr. Tay. Welcome to your family to Reno.
Thank you.
You're watching 2+U Nevada.